COVID-19, you know it's created myriad human tragedies and turned our lives upside down. You know the outpouring of support for frontline workers. This is what it sounds like on Thursday evenings outside my flat in London. New diseases keep spilling over from other animals, and this is simply the most serious and widespread since HIV.
Wildlife exploitation has been a ticking time bomb for, well, at least since the SARS outbreak in 2002-2003.
We go beyond the memes about bats and Wuhan to discover what we know about spillover diseases. We'll hear from a physician on the COVID-19 front line, from a campaigner against the wildlife trade whence many of these diseases come.
And that bomb has gone off.
And from a vet and public health expert who runs programmes to try to spot the next pandemic.
People are certainly recognising that we're all interconnected.
With me, Dr. Ian MacDonald, for this special episode is
Dr. Aysha Akhtar. I am a neurologist and public health specialist.
On Resonance 104.4 FM and podcasting around the world, we'll be asking about the causes of spillover diseases and how much difference it'd make if the world chose
the vegan option.
Welcome to the show, Dr. Akhtar.
Thank you so much for having me.
Please introduce yourself.
My name is Dr. Aysha Akhtar. I'm the CEO of the Center for Contemporary Sciences. Previously, I was the Deputy Director of the Army's Traumatic Brain Injury Program and a Commander in the Public Health Service Commission Corps.
Obviously, we're all isolated now. Where are you?
I am outside of Washington, D.C. in the suburbs of Maryland.
Where? In your kitchen? In your...
I am right now sitting in front of a lovely fire. It's a cool, wet April day here.
There's nothing worse than a lovely sunny day in the middle of a lockdown. Let's start with COVID-19 with a vegan physician on the front lines and then ask our expert guests where it came from. Then we'll have a general look at the diseases that spill over from animals and ask what are the riskiest interactions that create them and how we can stop them. So first, between her morning and afternoon Sunday shifts.
So I'm LJ, Dr. Smith. I'm a respiratory and general medicine consultant in the NHS.
Britain's National Health Service, a senior physician.
Senior physician, yep, that would work.
How has the pandemic changed your day-to-day work?
That work is dramatically different to what it was. So all our outpatient activity has been completely put on hold. Essentially, our entire focus is on patients with coronavirus. We see very little other conditions, which is very dramatically different to day-to-day work. Although I'm used to working with patients who have pneumonia, many of my colleagues are not, and we've had great support from people from dermatology, rheumatology, liver ITU, all sorts of colleagues that have come and joined us on the ward to look after these patients.
What's it like emotionally, this shift to a pandemic?
It kind of comes in waves, and it's been tough for different reasons at different times. So at the beginning, there was so much unknown and we just weren't sure what we were facing. And that was really difficult. It was very uncertain. We were rapidly trying to reorganise rotas and staff and space. Once things were a little bit more organised and there was still the fear of, will we be able to cope? Will our services be able to cope? Will we be able to look after everyone we need to? And that was extremely stressful, and that took a real toll on lots of people. Many of us talked to each other about the fact that we really weren't sleeping very well at all, and all we were thinking about was coronavirus. So I think once we were clear that actually we had sufficient capacity in our extended capacity to be able to look after everyone we needed to, we're able to take a deep breath again. But then some of the other emotional aspects perhaps hit a bit harder. We've had colleagues who've been unwell. And then there's still a lot of uncertainty. So we're not sure what the next month looks like or the next 6 months. And we've all got families and friends and other people we're also worried about. So we're also all very human and have the same fears and worries that people who are not currently working in hospitals do. What's helped a lot with keeping us going and keeping us well, both physically and mentally, is all the support we've received. So the public have been incredibly generous. We've had loads of donations here, and it's made a huge difference to not have to worry about getting lunch and getting tea and coffee. Really simple things make a huge difference when you're working long hours. So we've been very well looked after.
I'm contractually obliged to ask about the helpful supply of vegan food from the British public.
So there have been lots of donations from lots of different sources, and some of that is vegan friendly. I've had some excellent meals from both local places and from more national names that have been excellent and vegan. It's not universal, and it would be nice if that was always thought about from the kind of organisational aspect, as I know that there are other people who would like to make positive choices in their meals, not just me. So I think that would be great if that was slightly higher up the agenda, but we're extremely grateful for everything that's being given.
The other intersection is, would we be in this mess if the world followed the vegan option? And I want to ask, has it come up at the staff room?
So whilst I'm at work, I'm mainly focused on the care of the patients, and certainly that's taking up a lot of our time. But of course, there are moments where we do have time to grab a coffee and where I'm talking to colleagues, where the conversation about coronavirus extends a bit further beyond our walls and into the world. I'm known to be vegan in our department and amongst our staff, and things related to veganism come up quite often because I'm known to be, and so I'm asked questions. Certainly, we've had some discussions about the possibilities of this starting in the wet food market in Wuhan, and the contribution of having live animals, people in close confinement, and meat being sold.
More from Dr. Smith at the end of the show. Before we hear more about what it is, let's establish the basics of what it means to say that COVID-19 is a zoonosis.
Well, a zoonosis means an infectious disease that can pass from one species onto another. So usually we think of infectious diseases that humans get from other animals, but it can also be the reverse. So for example, in the past, there have been studies showing that we've passed tuberculosis onto elephants. We're seeing now that we are passing COVID-19 to some of the animals in zoos and even into domestic cats.
And spillover, is that simply a more Anglo-Saxon word than zoonosis that means the same thing?
Spillover is essentially just a lay term for zoonosis. This is a less technical term, but it does imply a pathogen spilling over from one species or one setting into the human population.
A pathogen, a bug that hurts us.
Yeah, a pathogen can be a parasite, it can be a bacteria, or it can be a virus.
And COVID-19 is a virus, a little strand of genetic material in a spiky bubble.
That's correct.
So, COVID-19, where does it come from?
My name is Jonna Mazet. I'm a professor of epidemiology and disease ecology and the director of the One Health Institute at the University of California, Davis.
Professor Mazet was a conservationist veterinarian who worked on oil slicks. Now she's an epidemiologist who runs initiatives to try to spot the next pandemic. You might also catch sound of Ted the dog jangling in and out of the room.
So no one knows exactly the location or the host of the SARS-2 coronavirus that causes COVID-19 disease. We have a lot of scientific evidence pointing us to an evolutionary host being a bat.
The one it's used to.
But we don't know which bat or where those bats live yet. I feel confident we will find that answer, but all the great minds working on this, most are really focused on controlling the current pandemic and human-to-human spread.
Obviously, there's been a lot of focus in the wild animal market in Wuhan.
Well, I can tell you that through our 10 years of the PREDICT project, we know that the wildlife food for humans value chain is very risky for spillover. While we don't know 100% sure where the exact spillover event happened for this one, we do know that those markets that put live animals together with a lot of people, mixing species, wildlife species, domestic species, putting them into really confined quarters is a perfect mixing vessel for viruses that can spill over to people. So whether or not this current outbreak originated in a live animal market, we don't know, but we do know that those are high-risk interfaces for this kind of transmission, and that we find a lot of virus at those kinds of sites in China and elsewhere. We also, are concerned about where people come together. There were multiple people that visited the market that became cases, but that doesn't necessarily mean they got the disease in the market, but they potentially were mixing people to people and transmitting in the market.
There's a lot of circumstantial evidence, but that's not good enough for science.
Correct. So in the end, we will want to have all the traceback information for all the human cases and understand the risk factors that those early cases experience to be able to get a better handle on this. And then we also need to know the hosts that can carry SARS coronavirus 2. And especially we're interested in the ones that carry it and don't get sick, because that means that they can be kind of more of a vector or a transmission host to people or other intermediate hosts.
Aysha Akhtar.
I would add that one of the problems also with these wildlife markets, and I would say any part in the wildlife chain really, is that you are dealing with animals who are treated very cruelly. And because of that, and partly because of that, their immune systems are likely to be depressed. And animals react to stress and distress in the same ways, in similar ways that humans do. So when we are distressed for different reasons, that can affect our immune system's ability to fight off infections. With the wildlife trade, and I would say with any part of the wildlife trade, not just the wet markets, you can bring together many different types of species who are jam-packed in close confinement, treated cruelly, distressed. Immune systems are likely down, and it makes it even easier for them to catch a virus from another species and pass it on to each other and ultimately on to humans.
And so wet markets are already an animal issue.
My name is Peter Kemple Hardy. I am the Wildlife Campaign Manager for World Animal Protection UK, and my role is working on campaigns related to global wildlife.
What are wet markets?
So, wet markets are basically markets that sell fresh meat, fish, produce, and also live animals in open stalls. Their name comes from them being kind of washed down, being wet environments, because animals are butchered on site. World Animal Protection, we're really clear, we refer to these in this context as wildlife markets, because it was really the presence of live wildlife for consumption that has resulted in this extraordinary pandemic and global crisis.
It's historically not that unusual to have animals killed where they're sold. What makes these different?
So in China, particularly, large-scale kind of wildlife markets are a relatively recent phenomenon. They spread throughout the 90s with kind of rise in affluence. Wild game meat sold at these markets is actually quite expensive, and consumers cite a range of reasons for consuming them. Obviously taste, but also like status, curiosity, purported health benefits, lots of values that are rooted in their culture. And the demographic, surprisingly, is often, well-educated, affluent, urban demographics.
How do you convince them to close this?
Well, I think there's probably two important points here. One, at the moment in China and in Vietnam, there's been imposed bans on wildlife consumption. So we think that's too narrow, because it's just focused on consumption, not the whole wildlife trade, but it's a really positive start. And those bans have substantial public support. In addition, another INGO has recently been doing polling in 5 Asian countries that's found large majorities supporting bans on these kind of markets. So there is a lot more support for stronger action within the countries where these markets take place than is commonly understood.
You could be forgiven for imagining that the wet markets are only in Wuhan and South China.
These markets are not just in China. They're in the United States, they're in parts of Europe, they're in many parts of the globe.
Obviously, this is far from the only recent zoonosis.
In fact, 60% of emerging infectious diseases are zoonotic, and 70% of those are from wildlife sources. So the relationship we have and the exploitation of wildlife is really creating an enormous risk to global health, as well as the obvious impacts on the animals themselves.
But the CDC has a stronger figure that says 75% of emerging infectious diseases in humans are from animals.
Both numbers have been tossed around, so it's hard to exactly say what the right number is, but it's safe to say that anywhere between 60% to 3/4 of emerging infectious diseases are coming from other animals.
But the bottom line is the majority of diseases that surprise us are those that have wild animals as their natural or evolutionary host. And that shouldn't surprise us that that's the case, because what it means, again, is that to be an emerging disease means that it's a new disease for us. And to be new, it's usually because we're naive to that pathogen that spills over into us.
Our immune systems don't recognize it. We don't have antibodies against it.
And so we're living and using the planet much differently than we have over, our whole history. And we're just having exponential human population growth, and we're moving out into wildlands, and we're bringing certain species into intense living situations with us as a human population, and that puts us at risk. So we have been able to identify where hotspots for this kind of activity are, and they tend to be where the human population growth is high. There's a lot of land use change, so you're grabbing animals or coming into contact with animals in new areas. Deforestation is very important. Road building, dam building, all of these things disrupt ecosystems. And you couple that with areas of high biodiversity, so there are many different wild species with their own microbiota.
The microorganisms that live on us and in us.
That can put us at risk. Those are all those risk factors that help us identify hotspots.
The hotspots they're talking about are this interface between wildlife and humans. Are there any you think they've missed?
Absolutely. They've missed a glaring hotspot, which is intensive farming. And what's particularly problematic about it is not only its potential for mutating the influenza virus, but because we know where these factory farms exist. We know that these are hotspots, and these are places that we can easily control, but we are not doing that.
I did ask Professor Mazet about that.
Well, certainly there's no more intimate interface with an animal than eating it, right? So if you wanted to limit your risk, that would be one major way to limit your risk. Especially, I'm most concerned about these novel diseases. So again, wildlife, because we've evolved to kind of come into a balance with traditional food animal species and their microbiome, though there's still risks there.
So I'm gonna address this point right here. We might have in the past been in a kind of balance with other domestic animals that we normally consume. And I'm talking about chickens and pigs and other domesticated animals like that. But we have drastically disrupted that balance with factory farming, with intensive confinement of animals. All bets are off now.
I put this to Professor Mazet after recording. She said she was talking about why the majority of spillovers are from wildlife, but agrees, quote, that the more we alter and intensify agricultural practices and extend them more and more into pristine lands, we introduce more disruptions into the balance, unquote. Back to our interview, I brought up the 2009 swine flu, which originated in America, and our best guess was coming from intensive pig operation in America.
Yeah, the question, so let's just take that. We don't like to call things swine flu or bat virus or things like that because we don't like to blame the animals. It's usually the way humans are interacting with the animals. And
the virus was being called swine flu because we suspected it originated in pigs. But there was a political pressure placed to use a more technical term, to disassociate people from their food sources. So there was a lot of political pressure because there was a lot of fear that people were going to say, oh no, this is swine flu. That means I can get it from eating pigs. Well, we know you don't get it from eating pigs.
You just generate it by eating pigs.
You generate it by eating pigs. You generate it by this entire system.
Professor Mazet agrees that industry pressure was, quote, a huge part, unquote, of why the terms were dropped. But coming at this as a conservationist, stands by what she said because she doesn't want to, for example, quote, have to constantly emphasise the importance of bats right now to keep people from killing them.
So the many species of bats are quite different from each other, and some are pollinators, so they keep our crops going. Some are seed dispersers, which is incredibly important as humans are fragmenting the landscape. So bats are super important to us for biodiversity and for the functioning of our planet.
Aysha Akhtar.
What we have seen, and studies have repeatedly shown, is that intensive confinement of animals is increasing both the frequency and the scale of outbreaks of these novel influenza viruses.
For many diseases like influenzas, humans have mini influenzas as well, and they can remix with animal influenzas, and that's what we worry a great deal about. So yes, intensive operations for the food chain are ones that we worry about for remixing. Whether or not the virus was evolving in a pig or a bird or a person, they have the opportunity to remix, and influenzas are really good at that and pick up characteristics that make them more easily transmitted, may change the amount of people or that are susceptible or how deadly the viruses are. So those are all worries.
A new influenza virus is a new virus. And that's what we're seeing coming from these factory farms, new strains of the influenza A virus. So they go through what's called genetic reassortment. So for example, the H1N1 2009 virus, that was what we call a quadruple reassortment virus. That virus had genetic material from influenza viruses from two different populations of pigs, from chicken populations, as well as from humans. And that basically led to a combination of genes that was not previously seen.
Like a book of mix and match heads and arms and legs produces a unique thing that our immune systems cannot recognise.
That's a great description.
So intensive productions and food and value chains are of a worry, for sure. For your audience, I think that they should feel vindicated about speaking out about that from this perspective, but I don't want to make people feel like they're fully protected. For example, another interface that we work on is how people interact with bats for bat guano collection, so their poop.
This bat guano example is very interesting, and it relates particularly to coronaviruses because bats carry a lot of them. But both guests agree it is not on the scale of either bacterial contamination from normal cattle manure or the other things we've talked about, like influenza virus spillovers in factory farms.
And people have a huge industry of going into caves to collect bat guano to put onto crops for fertilizer. There's also a burgeoning industry for farming bat guano by attracting bats to areas to roost and having sheets underneath those roosts and collecting that guano and putting it directly on crops. Those crops go directly to market. So there are many other factors that don't involve the animal meat products that also put people at risk.
Yeah, and she's right. We can have a completely vegan world, and it doesn't completely do away with our risk of facing new viruses. As long as we are encroaching and disrupting natural ecosystems, animals' natural habitat, as long as we continue this trade in wild animals, and I'm talking about both the legal and the illegal trade. I lump the bushmeat trade and the keeping of exotic pets all with the wildlife trade.
Bushmeat means wild animals sold for food in Africa. Professor Mazet.
We do know that Ebola spillover events occur more often than, of course, anyone would ever want. And many of those can be traced back, to, for example, to consuming bushmeat, sometimes not hunted, because we know that Ebola can spill over into species and make those species sick, wild animal species sick, and then people simply collect the carcass. We've seen that with chimpanzees. There's also one of the greatest pandemics of our time, HIV. AIDS has also been linked to bushmeat and chimpanzees. So there's certainly many examples to look at from the bushmeat trade.
Peter Kemple Hardy leads World Animal Protection's campaign on exotic pets.
The conditions that created this lethal hotbed of disease are really pervasive throughout the wildlife supply chain, not just related to markets or wildlife consumption.
Wildlife trafficking, or the illegal trade in wildlife, at least as it moves from the range countries where the wildlife live naturally, often traveling north to North America, to Europe, to China, that trade is run in a very dangerous and clandestine way. Of course, it's dangerous for the wildlife, but it is also the same people who traffic humans and traffic drugs and traffic arms that are trafficking wildlife. And I do think that that's a very important enforcement target.
So this story isn't just about China or wet markets, it's about the relationship between people and animals and exploitation of wild animals. And, you know, we're all part of the global community and we're all involved. The countries that are some of the biggest export markets for exotic pets are Western, industrialised, educated countries like the United States, like the EU.
For example, in 2003, pet prairie dogs spread monkeypox in America, a virus so similar to that vanquished scourge smallpox that the American Centre for Disease Control dug out the old smallpox vaccine.
It isn't just a story about China and what people are doing halfway around the world, it's also a story about us.
So to sum up, factory farming produces new remixed influenza viruses, and we're not covering antibiotic resistance at all today. Our treatment of wildlife opens us up to a literal world of harm.
That human health, animal welfare and the health of our ecosystems are completely interdependent, and that if we don't act now, the question isn't whether another similar pandemic will emerge, it's when and at what cost.
The threat that we are facing from new pathogens and potential new pathogens is fundamentally a story about how humans are with other animals. This isn't for us to lay blame on how these viruses emerge, but
to learn lessons.
To learn from what we're facing today, a new way of being with other animals, a way in which we see other animals as individuals, as sentient beings in their own right. And by doing so, we're not only saving those animals, but we will also be saving ourselves.
Thank you very much for listening, and Rob Masters for the theme. Please follow on Facebook and Twitter /veganoption and discover more at theveganoption.org. And let's end with a final word from Dr. L.J. Smith.
Lots of people ask, well, how could I protect myself from infection? What can I do? How can I make sure that I'm not at risk? There's no simple answer to that. As with many infections and many illnesses, the best way to protect ourselves is to have a healthy lifestyle. That includes a number of things. So it's really important not to smoke. It's really important to be physically active. And then the third area is diet. There's increasing knowledge about nutrition and its link with the immune system. There's no definite way that an individual can say, okay, well, I'm going to have this diet today and it's going to protect my immune system tomorrow. But overall, over time, if you're eating the most healthy diet, which is proven to be a whole food plant-based diet, then you're more likely to have resilience against any kind of infection, including coronavirus.
What would you say to vegans who want to raise this issue without getting the kind of reaction that some vegan campaigners have had in the press?
My advice to vegans would be to try to be positive and to bring people along in a positive way when bringing up this issue and linking people's choices with negative consequences. And that would be the same when we're thinking about the climate emergency as well as global pandemic. So I would think about the changes people have already made in their lives during this pandemic, which have been really positive, and think about the fact that everybody really wants to make a positive impact on the world. And this is another way that they're able to do this. People are feeling quite powerless, and this is something they can do for themselves, for their communities, for their own health, for the climate, and for animal welfare. And they can be a positive force in the world just by the choices they make every day at meal times. Yeah, I probably should go. I need to go back to the ward.
Okay. Stay healthy, as everyone says nowadays.
Thank you very much. Yeah, that is the sign off.